Thanks, Ron. High blood pressure can lead to many health issues. Merritt Bates Thomas of the Green River District Health Department says, know your numbers. This is Blood Pressure Awareness Month. Good morning.
It is, and it's a significant topic for many of the viewers. It's estimated that 40% of adult Kentuckians have high blood pressure, and it is the #1 risk factor for having a stroke, and it's a top risk factor for developing heart disease.
All right, so we know that this is a kind of epidemic in our own area and probably
throughout the country.
Yes. So what do people notice when they start having high blood pressure, or do they notice anything?
Many times it sneaks up on us and you really don't notice much of anything, especially if you're not seeking out regular medical attention.
Right.
Having an annual check, or if you see the physician, should see the physician more frequently. I think the key thing is just to be mindful and aware, and if you start feeling a little different, if you're not a regular person that goes to see the physician, then you want to heed that and go to urgent care if you don't have a provider, or see your provider.
How important are the genetics of it all, and then how important are the things we can do for ourselves to avoid it, but if we have it, live with it, manage it?
Sure. So there are the non-modifiable risk factors, which are our genetics, our family history. There's age, there's our gender, and then there's our race and ethnicity. We can't change those.
Those are the things you can't change.
Now,
right?
The family history, to some degree, you know, how much of that was impacted maybe by the lifestyle habits. The big modifiable risk factor is your lifestyle habits, and there's several of those. We talk frequently about the foods you select, how you eat those foods, how frequently you eat the good foods in your diet, the portion sizes of those foods. How active are you? Do you get plenty of rest? A lot of us are shortchanging ourselves there, and that can put us at risk for high blood pressure. So, and it goes on and on. There's Life's Essential 8 that the American Heart Association has, and you can go on and read more about those. And also mentioning too, for those listeners who, or viewers who smoke, that it's important that that be a habit you consider giving up, and if you don't smoke, don't start.
Yeah, I mean, it's really a costly one, and I think in every list of improving your health, it's exercise and diet, and don't add those things already into your life that really do compromise you.
And those can be a tipping point for us as well. I think the key thing is, so many times you see people with the family history. You see those risk factors that could be adding up for someone, and then you turn around, the person begins to make lifestyle changes, and lo and behold, they see a reduction in that blood pressure medicine if they have to take the medicine. They see improvements overall. And it's not one magic number. 120/80 has been the number we've held out there for so long. But again, it's about, as we commonly say, knowing your numbers and what those numbers mean for you, because one person's blood pressure isn't necessarily another person's blood pressure. You're basically monitoring and measuring what works best for you.
And all that information, the slide we just saw, how can they access that at home? Can they see that on your website?
So that will be posted on our Facebook page.
Okay.
We listed those risk factors. We also have several social media posts going up on our Facebook page for Green River District Health Department. And you can also go to healthdepartment.org to get more information, or reach out and call your clinic in one of our 7 county areas.
Get some help, somebody walk alongside you. Sometimes we need that. Thank you, Merritt.
Thank you.
We'll be back with more local lifestyles right after this. Stay with us.